probably won't label those. So here, if you want to mark on here what I expect you to know. Parietal bone, there's two of them. One's on this side, one's on the other side. This is your temporal bone. The squamous suture separates parietal and temporal. Lambdoid suture is the one towards the back, and it's going to separate parietal and occipital. The other suture that I would like you to know is the coronal suture, crown, and it separates your frontal from your parietal. Then, if I look, the external acoustic medius, that's the opening for your ear. That is part of your temporal bone. You should know that. Mastoid process is a rounded process. Styloid process is a pointy process. If you feel the base, so if I feel towards the bottom right behind my ears, there's a little rounded process, I can actually feel that. That would be your mastoid process that you feel right behind your ear. Here is the mandible, here's the maxilla, nasal bone you should know. And then these two right here. Temporal bone, I already told you. Zygomatic means cheek, so I expect you to know these two bones. On the zygomatic bone is the temporal process because it's going to hook to the temporal bone. On the zygomatic bone, on the temporal bone is the zygomatic process because it's going to attach to or hook to the zygomatic bone. So those four things I expect. As far as these inner bones, your ethmoid, lacrimal, I probably will not have you label those. Sphenoid, just make sure that you know the sella turcica is part of that. Bottom, probably won't have you label this at all, but I do want you to know that large opening for the spinal cord is the foramen magnum. I will not have this diagram as a labeling for anything. Inside, the only thing I want to show you here is a diagram of that crevice of the sella turcica. So your pituitary gland would fit right there. Here again, the insides where I will not have anything labeled from the inside looking outward of your skull. All mine will be from the outside. A little bit towards the end, an infant skull is not fully developed. If it were fully developed, those bones would be crushed during birth. So they have fontanelles, which we call soft spots. A baby, when it's born, has a soft spot on the top of the head. Those soft spots are actually called fontanelles. And the purpose of them is to allow movement of that skull during childbirth or during labor, like I said. And then it will also allow the brain to grow after the child is born. So when your skull is forming, if I look at the top of the skull here, here's my frontal bone, here's my two parietal bones, here's my sagittal suture, here's my coronal suture. Basically, this area right here is probably the largest fontanelle. So it's where those sutures are going to come together, but they have not completely formed yet. And that allows for movement of the skull. It is a little bit of an exposed area when the baby is small because it's not nearly as protected. And then as the child grows and ages, those bones will start to actually fuse together, and that's where those sutures will be at. So here's an actual diagram, so you can see, like I was saying, here's towards the front, so here's my frontal bone, and notice my frontal bone has not even completely fused yet. Here would be my two parietal bones, and here would be my occipital bone. And you can see these fairly large. This, when I think of talking about a baby's soft spot, that is the one that you can actually feel that on a baby's head. So fontanelle, it has not fused together yet. Those sutures are not all together. And notice there's other ones also. So main point there being a fontanelle is an area where the brain, or not the brain, where the bones have not fused yet, and therefore it is softer because there's not bone there. And that's where we'll stop for today.